With students returning to campuses in just a couple of weeks, universities are starting to pull from COVID-19 response plans to prepare for monkeypox.
Yeah, so far the Illinois Department of Public Health has reported 672 cases. That is across the state. But doctors and school officials worry the virus will run rampant on campuses since monkeypox spreads through close physical contact. Joining us is Dr. Shikha Jain with UI Health. Should colleges be approaching this similarly to COVID, maybe from the lessons learned from the start of COVID especially?
Well, I definitely think we should be taking lessons learned from COVID, but we have to remember that monkeypox spreads differently than COVID. So COVID, we know, spreads very easily. It's very contagious. We know that it's airborne, and it can spread just by standing next to somebody who is speaking. And not only that, COVID can spread if you don't have any symptoms. Now, monkeypox spreads more commonly by close skin-to-skin contact. It can exchange, if you exchange bodily fluids, that can also cause some transmission. If you touch somebody's clothes for an extended amount of time, or wear someone's clothes or bedding that has monkeypox lesions, that can also transmit it. So they transmit very differently, but COVID-19 is much more transmissible and much more contagious when you're in contact with somebody for a short amount of time, as opposed to monkeypox, where direct skin-to-skin contact is what we're seeing most often right now.
I'm glad you mentioned clothing too. It can transmit it as well. Let's clear up some misinformation. I've even heard this in a conversation just recently. I heard people say, "Oh, this is only transmitted through sex, and if I'm a guy not having sex with guys, I don't have to worry about it." Isn't that a problem? That is just making people think they don't have to worry about this. Clear this up for us, Dr. Jain.
That is absolutely a misconception and a problem, because as of now, we do know the majority of the cases are in men who are having sex with men. However, this virus transmits through skin-to-skin contact for prolonged amounts of time. It transmits from sharing saliva or sharing any bodily fluids. And again, if you wear somebody else's clothes that have monkeypox lesions, you could potentially get monkeypox. So while right now it is really circulating in that particular population, we have seen it in a couple of children across the country. So it is not only limited to that group of people. So we all need to be aware, especially if we notice lesions on our own body or someone else's body. It's really important that we need to take those extra precautions right now.
And how should college students be vigilant to avoid monkeypox outside of, again, when you talk about a sexual contact?
Well, for sexual contacts particularly, you need to make sure you're getting the contact information of the person that you're having intimacy with, and make sure that you're trying to limit your number of sexual partners. I think it's really important to remember, again, this can exchange through saliva. So sharing food and drink should probably be limited. Sharing clothing, especially in a friend or somebody who might have lesions, should be limited. Washing your hands, again, very, very important. And remember, we are still in a COVID-19 pandemic. So wearing a mask can prevent the spread of COVID-19. And it can also, in some cases, prevent the spread of monkeypox. If somebody has active lesions, we do know that respiratory droplets may be able to transmit monkeypox as well.
Let's talk more about the vaccine, Dr. Jain. The FDA, as we said at the top of the hour, just issued an emergency use authorization for one type of vaccine in particular. How much can this really help in the spread? And I know they're talking about getting several doses out of just a single dose. Explain that.
So this vaccine could be really, really great in helping control the spread and decrease the transmission. The good thing about this vaccine is if you've been exposed, you can also get this vaccine at that time. When it comes to the recent information about increasing the number of doses per vial, what they are doing right now is they're making the administration in a different manner. So as opposed to doing a more deep skin injection, they're doing it a little bit less deep for adults over the age of 18. That allows more of the vaccine to be utilized, so we can actually get 5 doses out of one vial as opposed to less than that. And the hope is that will allow us to have more vaccine available to those high-risk populations especially.
All right, thank you so much, Dr. Shikha Jain with UI Health. We always appreciate you being here to help us out.
Thanks for having me.
Take care.